if you are tired of all the sneezy and watery, itchy eyes from allergies.
There may be a new way to treat them. CBS 2's Dr. Max Gomez is here to tell us it's like allergy shots, only better. Dr. Max?
Yeah, that's right, Christina Maurice. If your allergies are bad enough, you probably started with over-the-counter meds, graduated to prescription drugs, and finally moved on to allergy shots. Shots work, but they take a while to help, and you have to go to the doctor often to get them. Here's a new and improved allergy shot.
Trees, grass, pollen, ragweed, and I'm allergic to dust mites.
The traditional way to conquer those severe allergies involves weekly shots of higher and higher doses of purified concentrated allergen, the substance that actually triggers those awful symptoms.
Completely stuffy, congested face, red eyes, puffy eyes.
But allergy shots have some drawbacks.
The holy grail has always been to come up with a way of avoiding that long 6-month period of injections and the several years of injections thereafter.
Now a new approach called SPIRES for synthetic peptide immunoregulatory epitopes could change this. While there's still shots into the skin, it won't involve as many or as often.
There's evidence to suggest at least 8 should do the job, hopefully 4 injections. They typically would administer them about 4 weeks apart.
The idea is to use just a piece of the big allergen that causes the allergic reaction. That peptide may be enough to trick certain immune system cells into calming the allergic reaction without causing the swelling and itching of a full-blown allergy. The SPIRE technique is in clinical trials, some patients getting SPIRE and others a placebo.
We don't know whether the patient is receiving active product or what is known as a placebo.
This trial is for people who just have dust mite allergies, but the company is developing SPIRE shots for other common allergens. Now, if those SPIRE shots work as hoped, allergy shots could become far fewer, faster acting, and longer lasting. They'd also be safer because that peptide chunk can't trigger the anaphylactic shock allergy shots sometimes can. Clinical trials are underway in the U.S. and Europe, but FDA approval is likely 2 or 3 years away, so a couple more seasons of misery.
I really do feel bad for people that, have really bad allergies. They look so miserable.
Oh, yeah, me too.
I know, all the time. The shots work, but, they're kind of inconvenient.
Yeah.
That's all.
All right.
Thank you,
Doc.
Dr. Max.